Thank you so much, David. It's an honor to have you here in this room, in this virtual room. And yeah, and I want to introduce you to all these people that are here, and I will be listening it by YouTube and other options. So, well, David is an emeritus professor of psychology of Sophia University of Palo Alto and a psychologist in California. And his work is focused on spiritual issues and, of course, mental health. He has been writing many articles, around 80, and chapters, and co-author of one of a very important thing that is in the co-author of the DSM-4 and 5, ability another category that is religious or spiritual problems. He has been doing workshops all around the world, and well, teaching many universities, well-known universities. Well, David is a reference, and I invite you, David, to talk about how you became a reference, what was your path, yeah, whatever you want to share about all this transition from the first LSD experience, and then until now, whatever you want. I will open it for you.
Okay, well, I think like many people, I'm what's called a wounded healer. My involvement in the field of mental health came from my own mental health, or actually now I would call it spiritual emergency. That was, let's see, 52 years ago. I'm an old man. And I had been hitchhiking around the United States after dropping out of graduate school at Harvard. I was on the road to find out, that famous Cat Stevens song. And I came to San Francisco, and this was the year 1971, and somebody offered me a tab of LSD. And I had never taken LSD, but I decided to go ahead and try it. And that was a life-changing experience, but it was also a crisis, because for 2 months, I believed I was a reincarnation of Buddha and a reincarnation of Christ. And Karina, I'm also, this is kind of an interview right now, but I have a whole presentation with PowerPoint and so on that I assume I'll be giving later in this program. Is that right? Yeah.
Yes, it's like that, David. Yeah.
Okay, so I'm just giving you the short version.
Yeah, the short version to update them with your life, with how you became this eminence in this topic. Yeah.
Well, so the mini version, because I have a whole class to present on this, but the mini version is, for 2 months, I thought I was a reincarnation of Buddha and a reincarnation of Jesus Christ at the same time, and that my mission was to unite everybody in the world together under a single religion, because, you know, Buddha had created a religion for the East, Asia, and Christ had created a religion for the West. And my mission now was to found a new religion, start a new religion that would bring everybody in the world together. And I was very lucky, because for those 2 months, my friends took care of me. They provided me with a place to sleep and food. I had no money. I could have easily ended up in a psychiatric hospital and put on medication. But because my friends took care of me, I was able to have the full experience of going on what Joseph Campbell called the inner hero's journey. And after 2 months, when I was back to normal, everyday reality, I then had to figure out what the hell just happened to me. I think that I was a reincarnation of Buddha and Christ. It seemed crazy to me, even though it was my personal experience. And so that set me on the path of becoming a spiritual seeker. So I, for the first time in my life, started to do some meditation. I took a yoga, Tai Chi. I studied with a Native American medicine man named Wallace Black Elk. And it really changed my life. Mm-hmm. It was my spiritual awakening.
Yeah, and one of the questions that after, updating us with this experience, in which way this spiritual awakening transformed your life? In which concrete ways? How, it developed in such a transformation for you?
Yeah, well, of course, the first thing was I went from being an atheist who thought religion was just a bunch of irrational bullshit to becoming a spiritual seeker and thinking I had to find out, how did I, who was raised in a Jewish family, think that I was a reincarnation of Buddha and Christ, about whom I knew nothing? So I started to read the Bible for the first time. As I said, I meditated and did Tai Chi and yoga, and I went into Jungian analysis for 5 years. And that also led me then to want to become a psychologist. So then I also went back to graduate school and got a PhD in psychology. And in my career, I did focus on the overlap between spirituality and psychology. So it became a part of my both personal life. I became, and still am, focused a lot on spirituality, but it also became my career. And as Karina mentioned, I've written many articles on spirituality and psychology, and I was one of the authors of this DSM, Diagnostic and Statistical Manual, category of religious or spiritual problem, which for the first time brought spirituality into the mental health system. Because before that, it was considered inappropriate for a psychologist or psychiatrist or psychotherapist to talk about religion or spirituality. But because it was now in the DSM, it made it okay to talk about religion and spirituality with a patient.
Yeah, and that was one of my questions. How it changed because that manual of psychiatry is very well known, and how it changed the way of the psychiatrist looking at spirituality. Do you think that it changed, and in which ways?
Well, I think the most important change was that it now became part of training for psychiatrists and psychologists to learn about religious or spiritual problems, because it's in the DSM. So every mental health professional needed to learn what that was about. And for many years, that was my focus on spiritual emergency. Right now, religious and spiritual problems are very important, but for most people, religion and spirituality are part of their resources, their strengths. So I now work and have written many articles on spiritual competency. And that means not only focusing on problems, but strengths. How can a patient's spirituality help them in dealing with depression, addiction, anxiety, and so on? So religion, it isn't just that religion and spirituality can be problems, they can also be resources. And so that has really changed the way psychiatrists and psychologists do work with patients, because now we have all these techniques like mindfulness, which used to be considered a religious technique that was not something that a mental health professional would use. But now we know it is actually a resource, a strength, and it can help people. So I would say that those are the two main things. It really helped exploration of religious and spiritual problems and crises and emergencies, but it also opened up the field of mental health to accepting that religion and spirituality are not psychopathological, which is what Freud maintained. He maintained that religion is pathology. And many other famous mental health professionals have said that. People like B.F. Skinner and Albert Ellis, all the founders of Western psychology were anti-religion. So this has been a really, really big change in the field to say that, no, religion can be a strength for people. It isn't pathology.
Thank you so much. Thank you, David. Wonderful explanation. And in some way, what are you doing now that is related also with this interview, with the invitation to do this little course of 4 hours, is related with education, with giving tools to people and how to treat, how to help people, how to in some way give the best, taking into account all these tools, sacred technologies, we can say, like rough spell about it. But yeah, this all training part. What do you think about?
Yeah, well, I think the main fields like psychology and psychiatry and psychotherapy are still a little playing catch up. They're still a little behind because there is now very, very strong research showing that religion and spirituality can be beneficial. And I've conducted a few of these studies myself, but there are thousands of such studies now showing that if I'm a therapist working with a patient, I need to know more about their religious and spiritual beliefs, practices, possible conflicts. We need to explore that just like we would need to explore their relationship with a partner, their career, their job, et cetera, we also need to ask our patients about their religious and spiritual beliefs and practices. And I've actually created an interview that is used in many mental health clinics. It's called a spiritual assessment, and it's questions to uncover a patient's religious and spiritual background, their religious and spiritual practices. Do they go to church? Do they meditate? Do they do yoga? Or do they have religious wounds? Were they sexually abused by a priest? And that affects their attitudes also about religion. So that's right now, when I give workshops in clinics and hospitals and so on, that's one of the main things I focus on, is training people how to conduct a spiritual assessment. And I hope that I'll get to do that in this course as well.
What do you think about the psychedelic renaissance and all what is happening in research in so many fields, in mental health field especially, and so related with that experience that you live, because it was kicked by a psychedelic experience?
Mm-hmm. Yeah. Well, I'm amazed that in my own life, I have seen such big changes in the mental health field. Things like meditation, yoga, qigong, and psychedelic drugs that were totally verboten when I started my career. It was inappropriate for a psychologist to even talk with a patient about psychedelic drugs, except to say, oh, stay away from them, they're dangerous. But now we know that for many people, their psychedelic drug experiences are profound, life-changing, transformative experiences if they're done with attention to the set and setting. So all of the new research that is being done with psychedelic drugs, they pay a lot of attention to set and setting. So for example, the way I did it, just somebody gave me a tab of LSD. I didn't know the dosage, and I just took it. No preparation, nobody to guide me, nobody to reflect, for me to talk with about it, and so on. We now know that that is not the right way to take a psychedelic drug. The research shows that you need to spend a lot of time, typically in the research that's being done at universities like UCLA and NYU and Harvard and so on. They spend like 5 sessions with a therapist before they take the psychedelic drug, and then another 4 or 5 sessions afterwards to help integrate their experience. So we now have a good model for how to use psychedelic drugs effectively and safely. And just in my own lifetime, this has been such a big change. And as I said, with meditation too. A personal story. I was teaching meditation to people who were veterans. I was working as a psychologist at the San Francisco Veterans Hospital. And a patient at the hospital complained that I was teaching religion to patients because I was teaching meditation. And the Veteran Administration contacted me and told me this was not okay for me to teach meditation, and that they were going to conduct an investigation of me. And my job was at risk because of this investigation of me for teaching meditation. And fortunately, this was in 1987. So what was that, 40 years ago? And John Kabat-Zinn, I think some of you will know his name, had already published 2 research articles on the benefits of meditation for anxiety, depression, and other mental health problems. So I was able to take these 2 articles and show them to the people who were conducting this investigation of me to prove that this was appropriate. It wasn't a religious technique. It could also be used in therapy. And so they actually then canceled the investigation. But my job was at risk for teaching meditation to patients. So that has also really dramatically changed, and mindfulness is now taught at many, many hospitals, many clinics. Many psychotherapists use meditation or mindfulness as part of their therapy. So in my own lifetime, I've seen such dramatic changes in the field of mental health that are very, very exciting to see.
Yeah, it has to do with this all new psychedelic movement, especially in hospitals, especially in places that we never think that they will arrive. And yeah, and in these psychedelic settings, because we are talking about in hospitals and in this mental health system, what do you think that is the most important, maybe, to take in account to be in some way taking care of the spirituality of each person? There is a common attitude, and also a question that we may explore deeply, but I think that it will be appreciated, yeah, and a little idea of that, or what do you think about that? Yes.
I missed that. Could you repeat the question, please?
Which do you think that is very important, taking into account spirituality, to have taking into account in research, in hospital settings?
Okay. Well, a hospital is a difficult place, I think, to do a psychedelic session because it feels so clinical. And, Stan Grof described his first LSD experience in Prague. He was they wanted him to lie down under a bright light, and they had needles in his arm, and they were monitoring him, with paper, looking at him and, what's going on with you now and stuff like that. It's not a good place and a good setting for psychedelic drug use. Now, even though the research is being done at hospitals, they take a room and they bring flowers, they bring pictures of, art, and they make sure that the patient is very relaxed and comfortable. They usually have two therapists, a man and a woman, conducting the psychedelic session. They usually have the patient bring in photographs of important people in their life, their husband or wife, their children, their parents, their friends, in order to create a setting of this is an important thing. It isn't like when I first took LSD, I just gulped it down, and fortunately I was outside in nature, but now you spend a lot of time making sure that the setting is nice and that they do the preparation beforehand so that the patient is also very comfortable, because many are not, are scared of taking the psychedelic drug. So the therapist needs to reassure them that this is, they'll be okay, it's not dangerous, they're not going to go crazy, and so on.
Yeah. Thank you, David.
So we now know a lot more. I mean, psychedelic drugs can be used in other ways too. It can be used more like in nature, in a group, etc. But that's sort of separate from using it as a psychotherapy technique. For that, we need to have, usually it's just one person doing the drug then, and two therapists, and there's a focus on either, something the person was traumatized by. Were they raped? Were they in a horrible accident? Or did they have a unexpected, like a loss, like or an illness? Were they diagnosed with cancer? Something like that. That they're working on in the therapy. So it isn't just like taking it and wondering what's going to happen. You have a goal in the session of exploring what's going on, and two therapists to help you in that exploration. So we now do have a good way of using these drugs so that they're almost always beneficial. The success rate is not 100%, but the success rate is like 80%, which is really high. For example, Mithofer's research on PTSD, post-traumatic stress disorder, they have about an 80% success rate in working with veterans of war who have seen horrible things or sometimes done horrible things. I know I've worked with veterans who have, as part of the military, they're told, bomb this house. And then they bomb the house. And then when they go in the house, they see that they've killed children. So that's very traumatic. And the research shows that about 80% of the time, by using, usually they use MDMA for that, they can cure a person of post-traumatic stress disorder. Okay, I'm going to have to take a 30-second break because I've got my grandson with me now, and he's a little fussy, so I have to give him to my wife to take care of. I'll be right back.
So sweet. I was looking who the baby was.
Okie doke.
Well, David, beautiful, beautiful scent.
Yeah. When I teach the class, I won't be able to.
What do you think about the future of the settings with?
Well, I think they still do the sessions in a hospital. So it still feels very clinical and kind of not very, like when you go into a cathedral like Chartres, just being in that setting will create a spiritual experience. And it's hard to do that in a hospital. So I do think once the research has shown that the use of psychedelic drugs in therapy is beneficial and helpful and effective, then I hope we can have better settings for this kind of work. And I also think the model that is being used now in psychedelic research and therapy is to use a high dose to try to create a mystical experience that is life-changing. There's another way of using psychedelic drugs. It's called psycholytic therapy instead of psychedelic therapy, and you use small doses. And instead of having earphones and binders on during the session, you can talk with the therapist, or I think you could do it as a. So right now, none of the research on psychedelics uses them in a group. And I think later, in the future, we will see more use of smaller doses and in a group. So that's my prediction of where I think we will see some new work. But right now, it's been shown to be so helpful for many things like PTSD, depression, anxiety, end of life. That was one of the first of psychedelics, was when people have a diagnosis of a terminal or life-threatening illness, many people become very anxious and depressed, and they've shown a psychedelic drug can help reduce the anxiety and depression and increase acceptance of the end of life. It's inevitable, but when you have a diagnosis, it often is very, very upsetting to people.
Well, David, thank you so much. I think that, that was our last question. And it was such a pleasure to hear your wisdom and sharings about all these years, because there are years of research, inner and outer. I can imagine inner. One of the questions that I thought maybe is the one that which are your inner, when you say spirituality, you say in the beginning that was really important in your life and open up all this work and path, and how you live your spirituality, which are the basis of your practice, just to pose it.
Yeah, my main spiritual practices are Aikido and Tai Chi. I still will use a psychedelic drug for some experiences. Usually then when I use psychedelics now, I use usually a small dose and I go into nature. And I will do that with my wife. I will do that with friends occasionally. And we want to be able to, walk, see nature, and so on. So that's why I use a smaller dose. And I'm still have a meditation practice. It's not every day, but I still do some meditation. And I consider my work doing this kind of thing with people, sharing about spirituality. That is also part of my spiritual practice. I'm not a spiritual teacher, but I think I've learned enough about spirituality and therapy that I can share with other people. So, you saw me with my grandson. So family is a big part of my spirituality. I'm living now in both Germany and in California. We have our daughter living in Germany with our granddaughter. So we spend, half our time there in Germany. And right now I'm in San Jose, California with my son. And he and his wife have a newborn 1-month-old child. And they also have a 1.5-year-old child. And taking care of them I consider that part of my spiritual practice. It's both beneficial for me to have that kind of relationship, and I think it's beneficial for them too.
Thank you
So
so
that's
much.
kind of my spiritual life now.
Thank you so much. It was beautiful. This deep sharing, this human thing that arise in conversations. And I am really excited that you will be giving this 2 days course in BMed platform. And of course, that you mentioned that you will do a training in Germany this summer. Maybe you can send me also the information, and for the people that want to have it, that has been, because also the personal contact, it will be nice. So
Okay.
Thank you. Thank you all the people that entered today to hear you in this conversation. It was in conversation with you, so it happened. Thank you, David.
Well, thanks for inviting me. And I've enjoyed talking with you all.
Bye-bye.